Hello! Today we are going to talk about antisense therapy. Mechanism of action of antisense therapy. It's a form of therapy for genetic disorders or infections. It is possible to synthesize a strand of nucleic acid that will bind to mRNA produced by that gene and inactivated, effectively turning that gene off when the genetic sequence of a particular gene is known to cause a particular disease. An antisense oligonucleotide binds to mRNA, and this double-strand region can inhibit the production of protein by two mechanisms, either stopping the ribosome from reading the message or leading to the destruction of mRNA by an enzyme already in the cells called RNase. Thereby, it inhibits expression of that gene, and the level of target protein is reduced by blocking translation and by altering the subsequent cascades, regulating cellular proliferation, differentiation, homeostasis, and apoptosis. Advantages of antisense therapy. Oligonucleotides can be synthesized in a short period, sometimes within 1 week or 2, because only the sequence of a gene is all is needed to initiate therapy. Antisense oligos are used for identifying the function and studying the control of genes, as well as for validating prospective protein targets in drug development programs. Sensitivity to therapy may be easily determined through database scanning or northern-southern plotting for unknown gases. As the target is often one-dimensional viruses, multiple-dimensional domains often targeted within proteins. The medical impact of gene therapy can create permanent results. Once the diseased genes are replaced by the correct genes, this therapeutic approach has the advantage of being a long-lasting, sometimes permanent results. Can be controlled, measured, and redirected as necessary without harming healthy cells. New treatment options are coming out all of the time. Several products, such as Yescarta, have come to the market recently, providing new options for treating lymphoma, leukemia, and sometimes genetic-related vision loss diseases. It can work in combination with cell therapy techniques, which give patients a powerful way to recover from their medical condition. Useful in treatment of various diseases including cancer, by stopping expression of genes responsible for synthesis of protein that stimulate cancer growth. HIV, antisense antivirals prevent viruses from replicating by binding and altering or suppressing the function of viral DNA or RNA. Cardiovascular diseases and beta thalassemia and cystic fibrosis by restoring normal splicing of the beta-globin gene in beta thalassemia patients. Limitation of antisense therapy. Antisense therapy cannot be used as a single target approach. This is because many diseases are caused by multiple unrelated genetic alterations. Antisense can act as toxins as they can bind to other mRNAs and cause immune activation. Only a few complementary oligonucleotides can successfully hybridize to a targeted mRNA due to the secondary or tertiary mRNA structure and/or to the proteins bound to the RNA. The natural antisense oligonucleotides that are composed of the ribose or deoxyribose sugar phosphate backbone and bases are quickly degraded in the body. This is because of the activity of nuclease enzymes that degrade them, so they become not effective. Some of the antisense therapies can cause hematologic changes, such as a reduction in the heart rate, blood pressure, and cardiac output, as they can activate the complement cascade. They cannot pass the blood-brain barrier or any lipid bilayer. This is due to their polyanionic nature and polarity. Applications of antisense therapy. Tubulointerstitial injury. It's an inflammatory cell migration which goes to the tubulointerstitium in the kidneys after ischemia reperfusion injury due to the MID-kine gene deficiency. MID-kine antisense phosphoruthioate oligodeoxyribonucleotide at a dose of 1 mg per kilogram in saline was intravenously administered to mice 1 day before or after IR. These results indicated that intravenous infection of MID-kine antisense ODN is a candidate for a novel therapeutic strategy against acute tubulointerstitial injury induced by IR injury.